Hi, I'm Dr. Mark Lewinter, licensed acupuncturist at Metro Acupuncture in Atlanta, Georgia, with my co-host, colleague, and mom, Dr. Andrea Lewinter. Mom, how are you doing today?
I'm doing well.
Excellent, excellent. Are you excited about today's topic?
I am very excited about today's topic.
Me too. Yeah, sometimes when we think about the topic, perhaps it's something that we believe will be helpful for patients to know about because it's basic information about acupuncture. Maybe something comes up in the news that is worth discussing. I came across today's topic because I received two calls pretty close together wanting some information about how to add in acupuncture for gestational carriers.
It's happening more and more. Families are finding different ways to expand their family, and this is just one of them.
That's right. And a large part of our practice is working with patients who have been diagnosed with infertility. And many of those patients are doing IVF and they're wanting acupuncture several weeks before their transfer, and then acupuncture on the day of the transfer before and after. And then we do acupuncture also a few days after the transfer. When an intended mother calls us and she's inquiring about acupuncture for her gestational carrier, I'm very excited to share how we would be able to help them in this process.
Yes, because it is a stressful event for both the intended mom and the gestational carrier.
That's right. And for the gestational carrier, the suggestions are really similar to what we would make for anyone who's getting ready for a frozen embryo transfer, which is
Yes.
that doing acupuncture a few weeks before the transfer, I believe, can be helpful for creating a sense of relaxation. Another way of saying that, regulating the nervous system. Acupuncture has been shown to help decrease inflammation. So perhaps it will make the body more receptive to the embryo. Acupuncture can help bring blood flow to all parts of the body, including the pelvic area and uterus. So I think that having the gestational carrier do acupuncture a few weeks before the transfer, and then on the day of the transfer, before and after, and a couple times after the transfer before the pregnancy test is what I like to suggest to them.
I find that protocol so very helpful for everyone that's involved in that dynamic. And I think, again, going back to the intended mom, is that she's getting a feeling that person is getting good quality care that's going to help her throughout her pregnancy as well as just get pregnant. I've had some questions from the intended mom as to whether, in the conversation of doing something for the gestational carrier, I've offered to the intended mom that she too can benefit greatly from acupuncture. How have you experienced that?
I definitely think that whether it be the intended mother, intended father, that everyone could benefit from acupuncture. And I'd like to talk a little bit more about how I think that they can benefit. I mentioned with increasing blood flow, or decreasing inflammation, relaxing the nervous system, but mentioned a little bit of a prescriptive regimen, a number of treatments and how to arrange the treatments several weeks before the transfer, a couple times on the day of the transfer, a couple times after the transfer and before the pregnancy test. But there are many variables. So I want to share with everyone that there's not one right answer for all patients. And I think knowing that acupuncture is a supportive part of the entire process is important. And there may be a situation where the gestational carrier lives close by and they're able to come to our location, or they live close to an acupuncturist and they're able to see that acupuncturist weekly without having to go through heroic efforts like driving an hour and a half each way. So with each individual, we want to take in and understand their particular situation. And with acupuncture being a supportive part of the entire process, if a person has to take time off work, if they have to drive a long distance, if the acupuncture almost becomes a burden, then I think it's counterproductive.
Yes, I agree.
I like to know a little bit more about the gestational carrier's proximity to an acupuncturist, proximity to the reproductive, where they're to reproductive endocrinology clinic, where they're going to be having the transfer, and then I can make the best decision.
Mhm.
Because it's not just a recipe and a cookie cutter explanation for everyone. So knowing that it's not a one size fits all, what are some things that are important that you would suggest for someone who is a gestational carrier that may be coming from a distance?
One of the things that, particularly if they're coming from a long distance, and they're using a reproductive endocrinologist in the Sandy Springs area, then I would say, let's see if we can schedule your appointments around your clinic appointments. And that kind of takes the edge off. The other thing, and again, this is through conversation and finding out a little bit more about the person and what their expectations are and how they relate to acupuncture. One of the things that I would recommend is let's look and see where there's an acupuncturist near you, because it would be to her benefit to do it over time. So there's several websites that I would look into and see which ones I felt were most appropriate for that person, giving her the information so that she could. A lot of these are designed around zip codes. So she knows her zip code, she knows her area, and that way she can do it. So very often I will give her one, sometimes two websites, but usually I try to hone it down to just one. And again, that's only if it seems appropriate for that person. Otherwise, just say, yes, come when your appointment is scheduled at the reproductive endocrinologist, and let's see if we can line that up. And generally speaking, we can always work our schedule so that we can accommodate that patient.
Yeah, I love that our practice is close to Atlanta Center for Reproductive Medicine and Reproductive Biology Associates and Shady Grove Fertility. And we're like 5 or 10 minutes away from
Yes,
major
yes.
reproductive endocrinology and infertility clinics. In your speaking, I wanted to remember that there can be a dynamic between what the intended mother wants and what the gestational carrier might want. So let's say that the intended mother has read some of the studies showing that acupuncture is helpful in increasing pregnancy rate, which it is. And but the gestational carrier has a phobia of needles. So then it's a combination of let's see if the gestational carrier actually likes acupuncture. I'm
Right.
very proud that we've been working with women who've been diagnosed with infertility for over 20 years. So I think that we do a great job with our pacing for someone who is experiencing acupuncture for the first time. By pacing, what I mean is going slow, understanding that less is more. Maybe we might be doing 1 point, 2 points, 3 points the first time. Maybe they have so much phobia of needles that we just might be doing acupressure the first time.
Hmm. Hmm.
And we have that ability if we're able to work with someone several weeks before their transfer. So having a phobia of needles to that extreme is a rarity, but it's highlighting that there's not one for everyone. And this is a supportive part of the entire process.
I think that goes back to being able to listen to your patient. And if that's an issue, how can we best help that person in this moment in time? And as they get more comfortable with whatever they're comfortable doing with regard to whether it's acupressure or stimulation through vibration, whatever it happens to be, as they get more comfortable, they may be willing to do more needle stimulation.
That
So again, I think listening and honoring where that person is so helpful. My children, when they come and the parents are coming along, the parent wants that child to have acupuncture, but the child isn't receptive. And yes, well, just do this, just do that. And we're working with two patients. The intended mom has her own values and so on. And this is one of the things that we can offer the intended mom. You come for acupuncture. Let's, so that she comes at the gestational mother, our carrier, with a more open heart, that it's not so rigid. So we're all in this together in different ways, and it's listening to see how we can take our skills and gifts and offer them for the benefit of the whole.
Absolutely. Have you ever had that situation where you walk into a room and something, maybe it's some friends or family, and nothing's being said, but it just doesn't feel right. And then you turn out later that there was an argument that was happening before you walked in. And maybe that is just something that's happening with the five senses, perhaps it's a sixth sense, but there is a relationship going on between the intended mother, intended father, and gestational carrier. And I have found that acupuncture helps regulate my nervous system so that I can think better, so that I am less reactive. I am more open to other ideas. When the emotional part of our brain, the limbic system, isn't as active, there's more access to the prefrontal cortex, logic, and reason.
Yeah.
Being able to have everyone regulated during this highly charged, important, precious, emotional time is of
Yes.
great value. So, yeah, now we're talking a little bit about the intended parent and how acupuncture can play a part of their story, their journey in the fertility process. Not everyone, but many people will get to the point of being an intended parent by having several failed cycles.
Yes.
And even though they may not be going through the medicines or the procedures, it can remind them of what it was like before. And I think there's nothing that will bring one more into the moment, from my experience, than an acupuncture treatment. So,
Yes.
so when I say that it is really something that I enjoy doing, working with intended mothers and gestational carriers, I mean it, because medical procedures and having a medical diagnosis that becomes chronic and goes on for a long time can affect someone's health and wellness. And as an acupuncturist, I want to improve their health and wellness to whatever degree I can, whether it be them getting from point A to point B or over the course of the several years of their life.
Mhm. Yes. And I think again, what you mentioned, Mark, is a lot of the intended moms have gone through IVF and it's failed time after time, and this is their next best option. And there's been trauma. And when there's trauma, this is something that can be, acupuncture is definitely something that can help in that traumatic state.
Yeah, and
So,
what is the trauma? It can be heartbreak, disappointment, anxiety, having the highest of highs, perhaps a positive beta HCG, a positive pregnancy test, and then just a few days later, that it not being the case. And
yes.
and that's just one example. So this process can be the highest of highs and the lowest of lows.
Yeah. Because as you mentioned, it's more than just, oh, this didn't work. There's heartbreak. There's the anticipation of life, a new life in your life.
Yeah,
And all of a sudden for whatever reason, that's
right,
taken away.
right.
And that's the trauma. It's That's
And,
all the drama.
and everything I think in life comes back to relationships. So perhaps when not again, not all couples, but many couples or will start with trying to conceive together and they will perhaps not be able to be successful. And then they may bring in a physician to help them. And that physician has a team of helpers. Now you're having a relationship with those people. It's like in the circles getting bigger. And now, for whatever reasons, it's suggested that by the physician that you bring in a gestational carrier. And they may even be bringing in an egg donor.
Yes.
They may be bringing in a sperm donor. Now the relationships are getting bigger and bigger.
And
Something that might
sometimes
have
it's
started out,
both.
pardon?
And sometimes it's both an egg donor and a sperm donor.
Absolutely. So
Yes.
we, there's something about when you bring in a new relationship, you really want to be ready for that new relationship.
Yes. Hmm.
And I find that one way that we can get ready is by having clarity of mind. So whatever the intended parents can do to have clarity of mind, counseling, meditation, prayer, acupuncture, I believe that will be beneficial for them getting ready for this new relationship. And a
Yes.
new relationship can be very exciting. And I think it can be more exciting when one is ready and they're not carrying the disappointments of the past.
Yes. Yes.
For me and for many people, acupuncture has been the thing that helps me feel centered and ready to face the next day with a fresh perspective. That may not be the case for everyone, but this is why I think it's important for the intended parents also.
I agree with you. And I think, not to be a generalist here, but I think that one of the things that acupuncture is very safe. And we don't have to worry about, is this an invasive process and so on. It's very safe. So after that initial dynamic, whether it's fear or apprehension or anxiety of starting something new, such as acupuncture, I think that the patient can really begin to embrace the newness of what they're stepping into. We can't control anything outside of ourselves, but we can help ourselves step into that unknown because it is unknown and none of us are comfortable with unknown. So the more we can do to help ourselves, we can then offer greater help to others, which would be our gestational carrier.
Absolutely. And this is a shift in conversation, a little bit of change of topic slightly. I also believe that even one acupuncture treatment is better than none in most cases. That if someone had extreme fear of needles and they really are feeling forced to do acupuncture and they know that it's not right for them, then they shouldn't do acupuncture. But if someone's willing and interested, and but they
Yes,
only have time to do acupuncture, one session, I even believe that's helpful. So
I agree. I agree. Yeah.
the it's a complicated process working with a gestational carrier and intended parents, but that complicated process is something that I think we love working with at Metro Acupuncture. And I believe that with our experience and mindset and passion, that we do a good job. If someone is going to be having a transfer in the Atlanta area, if they are just needing questions about how to add in acupuncture in getting ready for a frozen embryo transfer, please feel free to give us a call because we're here to help.
Thank you for your listening.
Thank you. Have a good day.